Welcome to the ASRS Oral History of Retina series. The purpose of these interviews is to capture first-hand stories from individuals with unique retinal insights of historical significance.
Through these discussions, we will fill in gaps in our understanding of the evolution of the science and practice of retina. And it's our hope that these discussions will serve as the illuminating element in the larger mosaic of the history of retina.
It is my true honor to be joined today by Dr. Audina Berrocal. Dr. Berrocal is a professor of ophthalmology at the Bascom Palmer Eye Institute of the University of Miami. Today, she will share insights about the special legacy her family has had in the world of retina and how her unique upbringing has influenced her own remarkable professional journey. Dr. Berrocal is the youngest daughter of the late Jose Berrocal, an internationally recognized retinal surgeon who was the first retina fellow at the Bascom Palmer Eye Institute under Dr. Edward Norton. He went on to be the first retina specialist in Puerto Rico, director of the Department of Ophthalmology, and he's held a special place in the history of retina. Audina and her sister Maria, who is also a renowned retinal surgeon, grew up assisting in their father's clinic where they came to know many of retina's most preeminent surgeons. Dr. Berrocal went on to complete her medical degree and ophthalmology residency at Tufts University, and then her medical, surgical, and uveitis fellowships at the Bascom Palmer Eye Institute. Dr. Berrocal then joined the Bascom Palmer Eye Institute. She is one of the world's leading experts in the medical and surgical management of retinopathy of prematurity and pediatric vitreoretinal disorders. In fact, she was the first surgeon to use and treat the youngest patient in the United States with the first FDA-approved gene therapy. She is an exceptional researcher, a gifted educator, and a strong advocate for women and minorities in the field of ophthalmology and retina. It's my pleasure today to welcome Dr. Audina Berrocal.
Thank you, Tim. It's a pleasure and an honor to be here.
Nina, you have a unique story, a unique family story, and a unique personal story. Could you take us back a little bit to how your exposure to medicine started and how that influenced you?
You know, I was born to a family with a father who was the first retina specialist in Puerto Rico. And I'm the third of three kids. I had an older brother who unfortunately passed away. I have my sister Maria, and then myself. So when my father came back from having done, Bascom Palmer Fellowship and Escapist Fellowship in Boston, he comes back to Puerto Rico to practice in 1966, I believe. And then the next year I was born. So I was born into a family with already a practice of retina in Puerto Rico. And, as a little girl, I would just go and work in my dad's office. I mean, he worked Saturdays, so we would go and pick him up at noon and then have lunch. And, his work was part of my life. I can't think of my childhood without thinking of ophthalmology, basically.
Fascinating that it started so young for you, but it wasn't always sort of preordained that you were going to go into medicine. Is that correct?
That is correct. And when you're a child and the only thing you see is ophthalmology and medicine, and then you go off to college. I went to Princeton. I thought that, maybe there's something else for me. I don't necessarily need to do what my family does. And my older brother had also gone to Princeton. He was 10 years older than me. And he did not want to do medicine. He went into the Woodrow Wilson School of International Affairs. When he finished law school, he came back to Puerto Rico, and he wanted to be sure that I would get into a good college. He was like a father to me. So comes back, and at that time, the government had changed in Puerto Rico, and they needed a chief of staff. And my brother got the position at the age of 28. So he was one of the youngest chief of staff in the history of Puerto Rico. So seeing that, I decided, well, seeing how his life took course, I decided to maybe think of going to politics. I major in political science with a minor in Latin American studies, and the summer between my junior year in college and my senior year, I work in Congress, and I work for two different representatives. I was in the House. The reality is that you get to Washington and you see that it's not really about people. It's who you know, what you do. It's a lot of interest about power, and not necessarily for helping the majority of the people. And that was my disillusionment with politics. So, graduated from Princeton, had no idea what I wanted to do. Went back to Puerto Rico. My brother was there. We traveled together for a while. He had to go to some meetings. I would go with him. And, I thought, well, maybe I could be a lawyer. I could be a paralegal. And I had a friend across the street who I used to babysit for his kids. I've always liked kids. So I go to his office to interview for a spot as a paralegal, and he says, "Nina, I'm not going to give you a job." I was like, "Why?" And he said, "I like you too much to give you a job. I think you should consider medicine. I see your father has a great life. He's his own boss. He's totally independent. He really helps people. I want you to think about it." And honestly, that was like the nudge that I needed to really think about going into medicine. So then my whole life changed, and I had to do some pre-med courses. And I decided that I wanted to do a year in a lab. And at that time, I told my dad, and I said, "Dad, I want to be in a lab. Who do you know?" And he said, "Well, these people. Do you want to write a letter?" And I said, "Okay, give me names." So I wrote a letter, and a lab in Massaneer answered me, and it was, Evangelos Karagudas and Shiz Mukai, who I didn't know anything about Shiz, and they were doing P53 work, doing PCRs in the lab, looking at skin melanomas versus choroidal melanomas, and they said, come and interview, and if we like you, we can't pay you, obviously. And then I go like, "Don't worry, I have, Berrocal funding, so it's fine."
Where are we off to for medical school, and how did that work?
During my year of lab at Massaneer, I applied to medical school, and I remember that the first med school I got in was super early because it was a rolling admission to UIC. And I go like, "Oh my God, I'm in med school. It doesn't matter anything, I have one." But I ended up interviewing at Tufts. And I remember that the doctor who interviewed me was, I think his name was Sacco, if I remember correctly. And he was a radiologist, and he had gone to Princeton. And we just clicked. Those interviews that you are like, I left that interview and I said, "This is the right med school for me." And, it was. That's where I ended up going. So I stayed in Boston for, medical school. And during my medical school, I did research with, in the ophthalmology department with Tom Hedges. And, in my life, I've met all these people through my childhood. I met Tom Hedges and Tom Hedges' dad when I was a little girl. I remember when I finished Princeton, we went to a barbecue at Tom Hedges' father's house. When I finished, my parents were visiting, and we go to his house. So, I remember I used to babysit for Mom and Eat Kids, Niels and Nikki. Stanley Chan would come to my house. All the greats of ophthalmology honestly stayed in my house. My father hosted them at some point, and we went to some meeting. I mean, I lived my life at meetings. I remember I graduated from high school, and it was the Gonan meeting in, I want to say, Interlaken. And, I'm the only child that went that time because my brother and sister are gone.
So Tufts for medical school, when do you realize it's going to be ophthalmology?
When I was a little girl, I used to play with the drum in my dad's office. I used to play with the 3D test, so all these things were like my toys as a little girl. And now I'm with Dr. Hedges using all those tests to do exams. So it just felt natural.
And going into your residency, you felt that was the place to be?
So I applied to residency, and lo and behold, I matched at Tufts. And, my chairman was Carmen Puliafito, which I remember asking my dad, who is she? And dad goes, Nina, it's Carmen. He's Italian. It's a he. And I'm like, oh, my God. Okay, so Carmen was my chair. And, Carmen was a tough chair. He was very demanding of his residents. Carmen would make sure that the residents would be at lectures. If you weren't there, you would get a phone call, a beep from his phone call. And you knew that when you got that number, you were in trouble. There was something not quite right. But he was a very hands-on chair, at Tufts. And I think that kept everybody very motivated to do well and to work hard. So, I think that, residency for me was a place that I was able to really come into the realization that I found what I really was meant to do in a way.
So you're a resident, you're with Carmen. Carmen has ties to Mass Eye and Ear, Carmen has ties to Tufts. Tell me about your fellowship.
When the time came for fellowship match, I applied, and I remember that in the interview trail, it was always 7 boys and me. 7 boys and me. There was another girl, Sharon Solomon, who's now at Johns Hopkins, but it was Sharon and me, and that was it. Either her or me or the two of us together. So, we knew, I knew that it was going to be hard to get a surgical fellowship just because you could see that, everybody interviewing you basically was a guy. I mean, there were very few women in the interview trail. I remember Julia Haller was wonderful when she interviewed me. I remember Nancy Holocam interviewed me, but I can name them. It wasn't like I went to a program that 3 women were in that department. So I knew it was going to be hard to get a surgical fellowship. Around the time to put in my match, Harry Flynn called. And, I heard of Harry Flynn because of my dad. He calls me up and he said, listen, we would like to offer you a medical retina fellowship for you. So we want you to come here for 1 year of medical. And I said, well, Dr. Flynn, I really want to be a surgical retina fellow. So, I don't really want to do just medical. I really want to do surgical. And he's like, well, Nina, just come down. You'll do medical, and then, we can, you can apply, and then you can get the surgical spot the next year. And that made me very uncomfortable because what if I don't get what I really want to do? And I remember calling Dr. Flynn back and saying, Dr. Flynn, thank you very much, but I really can't do that. And he calls me back and he's like, Nina, I really think you should consider this. I ranked them and I matched at Bascom.
So you're coming to Bascom Palmer for your fellowship, initially looking at a 1-year medical fellowship, but that's not what you did.
That's not what I did. So it turns out that before I graduated, like around June of my last year of residency, I get a phone call from Dr. Flynn. He says, Nina, there has been a little change, and I want you to start doing the surgical fellowship first because the person who was going to do surgical has decided not to do it. So we want you to start with surgical. And I go like, oh my God. And oh my God, because I was pregnant. I had figured that I'm going to do a medical retina year. I'm going to have enough time to have a baby, all these things. So I must have been like 3 weeks pregnant when Dr. Flynn called me. And of course, I go to one of my attendings, Katrinka Hare, who is an oculoplastics attending who had 5 kids. And Carmen hired her pregnant. I remember her walking through Tufts with the big belly, and we were all like, oh my God, that's never seen. So I go to her and I said, Katrinka, this is happening. They're offering me the surgical, fellowship. I don't know what to do because I'm pregnant. I'm not going to be able to do this. And then she's like, Nina, first of all, you don't know if this pregnancy is going to stick, right? So you keep your mouth shut. She said, start, take it. And by the time, it's going to show, you can tell them, and they're going to love you, and you're going to be fine. It's going to be fine. And, I trust her. And I really went with it. And she she's a lovely, lovely woman. And she goes like, just do it, you'll see. And she was right.
When did you start to explore your interest in pediatric retina?
I did my first fellowship, I did vitreoretinal. And remember, you were one of my attendings. And I luckily had exposure, a lot of exposure with you, because at the time we were only 3 fellows. So we spent a lot of time with you, and you had taken over the pediatric practice from Patrick Rupp-Seaman, who had left Bascom, and all those kids were left under your care. And at the same time, I remember that John Flynn had left Bascom Palmer to go to Columbia. So also the person who had been taking care of the ROP service had also left, and you were doing all these things. So my rotation with you, we were doing retinoblastoma, we were doing retinopathy of prematurity, we were doing fever cases, we were doing all these complicated kids cases. And honestly, I was in heaven, because I loved it. I loved taking care of the kids, the complexities of their eye care. I like the dealing with the parents and the mothers and the kids. The kids are so nice. They're so honest and open, and it's so easy to work with them if you really want to work with them. So for me that was great, and I think that's when I started thinking that maybe I could have a career in pediatric retina, and I had the pleasure of having John Flynn and you as 2 of my mentors. And John Flynn, came down and he went to RP rounds with me, and he showed me the babies, and it was honestly priceless. I mean, I remember him coming to the NICU, all the nurses hugging him. Oh, it's so great to see you, John this, John that. He was really like a big figure for retinopathy of prematurity, and a big figure for Jackson Memorial and Bascom Palmer. So I remember him telling me, Nina, remember, let the disease teach you, and it is so true. I've learned so much by going to that NICU week after week after week for the last 22 years of my life.
You're really recognized as an outstanding teacher, and your fellows love spending time with you. Was that natural for you?
I think it's natural. I think I saw a lot from my father. He believed in educating people, his residents, his fellows. He always had people from Latin America coming to his practice, spending time with him, just learning whatever he could teach. So, he was never... He never thought that the knowledge you had was for you to keep. It was to teach others so that others could keep teaching. So I always saw that.
You're at Bascom Palmer. You're actively involved in the fellow teaching. You're very strongly focused on women in ophthalmology. And you're handling a pediatric retina service that rapidly changes with the advance of some of the treatments in ROP. What was that like?
I'll tell you that I think that that it's been fascinating to watch how a subspecialty has been created, and we have to give praise to who deserves it in this, which is Mike Tracy, who in my mind is the father of pediatric retina, and he really started a field where there was none. And I think a lot of us in this country who do pediatric retina have pushed the field forward. I think digital angiography has changed the way we look at kids. Lasering children, injecting anti-VEGF in kids and in ROP, that has changed, eye diseases for kids. I mean, we were destroying eyes with laser. Now we're saving eyes with anti-VEGF, which has been fascinating.
You've not been averse to sort of blazing your own pathway. So I remember that the laser approach changed, and there was a lot of controversy at Bascom Palmer about that change. And then when you started to first inject ROP babies with anti-VEGF, even in the US, there was much controversy. Can you tell me what it's like to be doing something where there's maybe a community that's not comfortable with what you're doing?
It was hard because, you were doing something that you have so many people against it. But, since I truly believe that anti-VEGF was the perfect treatment for retinopathy of prematurity, I knew that I was pushing for the right thing. And having a chairman like Carmen at the time, having you as a mentor, having people who I knew had my back at the time, I think that it allowed me to do that with force. And, you know, I remember to this day treating the first kid for salvage treatment for ROP. I still see her. She's now like, I want to say like 15 years old. The mother, her, and I are very close. And this girl came to me on a Friday afternoon at 5 o'clock with progression after laser treatment for ROP, with horrible eyes. And the only thing I could do was think about injecting, because I knew that kid was going to go blind if I didn't inject her. Surgery was not going to do it. Nothing else was going to do it. And I had a very good NICU attending at the time that I called her up and I said, listen, this is non-FDA approved. This is what I think we could do to salvage these eyes. And she goes like, I will support you in whatever you want to do. So I talk to the mother, I sit with the mother, I explain everything to the mother. I called Dr. Pugliafito and I said, Dr. Pugliafito, this is what I'm going to do, and I want you to be aware this is going to be the first baby treated as salvage. I call you and you go, do it. And, you know, and that girl, you know, to this day, she sees out of both eyes. But I will tell you, if I didn't have that support system and a mother that understood the gravity of the situation of her kid's eyes, I don't think she would be seeing today.
You've also been a pioneer in the use of gene therapy, which has totally changed how we look at some of the diseases we manage. What's that been like for you?
Well, I will tell you that having done that surgery and treating all these kids that I've treated with Luxturna has been one of the greatest moments of my career. Not only because it's the first time that I was able to do a surgery that had not, you know, a procedure FDA approved that had not been done before, but the fact that I was able to impact a family's life so immensely in one surgery. And, you know, the first kid, the youngest kid treated in the United States was Creed. And I had the pleasure of meeting this child and the family and treat them, you know, both eyes. And within 24 hours of treatment, this mother had my text, and she started texting me things that, oh my God, he doesn't need this much light. Oh my God, he's looking at the food when he's sticking it with a fork. So I was able to be with her moment to moment by text and images and videos that she sent me of things her son, who's now 9 years old, had never done before. She goes, Dr. Berrocal, going to the supermarket with him is like a little toddler. He's now looking at things on the floor that he didn't realize were there because, you know, the visual field is compromised, and he's touching everything. At home, I have to close everything under the sink because he wants to take everything out. So it's been a fascinating journey as a physician. And especially because, you know, in med school, we learn about, you know, viral vectors and changing the genetics of humans, but I never thought that I was going to be doing that in my career, in my lifetime, and here we are. And it's truly like science fiction. I mean, we are changing the DNA of these kids. That's fascinating.
You know, what I think is amazing is that, you know, you are a clinician surgeon. I mean, you really take care of your patients, but you teach while you do that, and then you write about what you're teaching, and then you speak about it around the world. So do you feel that's the giving back for you?
I think so. And I think, honestly, having an international pediatric retina fellow, for me, I have one every year. I think that's important because in the rest of the world, we're very lucky in the United States that we have a handful of pediatric retina surgeons, but in the rest of the world, people don't really dedicate a career to pediatric retina. And I think by training these people from, you know, I've had somebody from Thailand, I've had people from Mexico, Brazil, I think, and Costa Rica, I think that we are, you know, sharing that knowledge so that hopefully we're going to save vision in kids in parts of the world that vision really is such an important way to be successful in a society. So for me, you know, teaching my residents and fellows, yes, it's important, but teaching outside the United States and teaching in countries that, you know, they need it so desperately, I think that's a real contribution to the world.
And you've been very active in multiple societies within the field of retina and ophthalmology. Why do you think that's important?
Well, I think, you know, as women and as a minority woman in this field, I think there's a lot we have to push for, if you may. I think that in order for things to change, you have to be involved. You know, it's very easy to sit at the sidelines. I say, oh, this should be different, but you're not doing anything to change it. So, you know, I feel that that's important. And I feel that, you know, let's suppose I do something and I do it poorly. Then it's going to be like, oh, we're not going to take another woman because this woman did it poorly. Oh, we're not going to take another Puerto Rican woman because this Puerto Rican woman was terrible. We're not going to take a 5-foot-tall woman who has dark hair because that was terrible. So I think that what I do and what we do, especially as women and minorities, will open the path for people behind me. And I think people don't realize that, but that is so important. You know, I represent not only myself, but I represent every Latin woman who wants to be a retina specialist, every Puerto Rican woman who wants to be a retina specialist. So, you know, I take that seriously, and I think it means a lot.
You've played a role in many of the societies, but you're on the executive leadership track for the American Society of Retina Specialists. Why do you think that's important? How do you think that's gone for you? Are you excited to have a presidency in your future?
Oh my God, that is the biggest honor I can imagine. And excited, of course I'm excited. I think in the history of ASRS, I don't think there has been a Hispanic or Latin woman president of ASRS. So I take that with great honor, and I'm very excited to be on this path, which I never imagined I was going to be, honestly, but here I am, and I can't wait to really grow in this society.
So you've had a remarkable academic career at Bascom Palmer. You've started and you've never left, and you're a full professor at Bascom Palmer now. And how does it feel to have brought that back with your dad, the first fellow, and you, the first full professor?
You know, it's pretty incredible. I think that my dad would be ecstatic, you know, to see how his 2 daughters' career turn out. And now with my nephew coming along, you know, he's also doing ophthalmology now at UIC, and I promise you, he's going to be a retina surgeon for sure. You can even see it this early. So it's pretty magical. I mean, it feels like I am where I was supposed to be, doing what I was supposed to be doing.
It's kind of an amazing story from an amazing family. So thank you very much for speaking with us today. Truly a leader and a legend.
Thank you, Tim. It was my honor.